Even with the vaccine rolling out around the world, there is deep concern about a fresh COVID strain in Brazil that is killing the young in their thousands. The country is swamped by new virus cases, with a warning to Australia: the Brazilian variant is far more dangerous than anything we have seen before.
The situation across Brazil is very grim, and the healthcare system has pretty much all but collapsed.
Rio de Janeiro's iconic Copacabana beach, covered with hundreds of body bags, a tribute to the 400,000 Brazilians who lost their lives to COVID-19.
Crisis in Brazil is going from bad to worse. And unlike other countries, the virus is killing many children.
Usual holiday in Rio de Janeiro, with empty streets and a crowded sidewalk. Protesters angry at the latest government edict.
COVID-19 has forced the world to create a new system, a new way of living in order for the people to survive from the challenges brought by the virus. What was seemed to be normal before has become deadly in the present. Hugs, kisses, and simple mass gatherings have become weapons to endanger lives. Global society is the idea that people around the world are completely integrated with each other. Global civil society serves to channel global public opinions and put policy ideas onto the international agenda. It indirectly strengthens the capacity of the subjects to influence global actions and enhances the accountability of international decision-making processes. The global society strengthens the unity of the world to lessen vulnerability. It helps the world to cope with the challenges that all of us are facing. Countries are giving aids to other countries, not only for the fear of the world and global economy to collapse, but also for the sake of humanity.
A gente vê que apesar do apelo, não só dos profissionais, médicos, toda a área de saúde e os governantes, o pessoal se cuidar, usar máscara, não aglomerar, as pessoas ainda insistem em estar fazendo aglomerações, fazendo essas festas clandestinas.
In just 24 hours, 4,195 people have lost their lives due to the COVID-19 infection. It has been said that it is the highest single-day death reported in the country. The fast spread of coronavirus variant found in Brazil has caused widespread worry of people throughout the globe. Hospitals are overcrowded, people dying as they wait for treatment, and health system is on the brink of collapse. And now the country's total death toll is in 337,000, second to United States. The coronavirus crisis in Brazil is going from terrible to more regrettable. Doctors would call it a humanitarian catastrophe.
Population of 211 million, there are about 14 million official cases, close to 66,000 confirmed infections every day. And to put it into perspective, the death toll globally has passed 3 million. Over 500,000 of those in the US, in Brazil, about 375,000.
It claims that authorities' failure in implementing evidence-based public health policies has resulted to deaths of far too many people. President Jair Bolsonaro has promised to keep his country open. He persistently underestimated the severity of the virus. But now, he is focusing his attention in the widespread vaccination campaign. But critics would say it is a little too late, for formation of new variants of the virus is highly contagious, plus the delay in the vaccine distribution is creating more problem. The situation in Brazil is getting out of hand. People would say It's the largest humanitarian tragedy in Brazilian history.
The devastating effects of COVID-19 has also triggered socio-economic crisis. From the beginning of the pandemic, the unemployment rate is in the state of vulnerability. According to the Brazilian Institute of Geography and Statistics, the unemployment rate rose to 13.9%, the highest in the last 3 years. There are nearly 14 million who are unemployed, an additional of 5 million who have stopped looking for jobs, and 40 million informal workers. Even with emergency policies, millions of workers does not have any access to compensation. Because of this, a lot of businesses have struggled from bankruptcies, which leads to closing of businesses. Workers have also struggled from layoffs. It has also resulted to food insecurity and hunger, and some even started to beg food or money in the streets. Lastly, it has greatly affected the access to healthcare due to financial incapabilities.
Então, preservar a vida desses seres aqui é muito importante. E a sociedade tem essa responsabilidade, o governo tem que ter essa responsabilidade de preservar as nossas vidas.
This is an alarming situation happening right now in Brazil. But there are things that Brazil can do in order to mitigate the seriousness of the situation. First, the government shall support and have the will to win and fight against COVID-19 virus. Since Brazil is a federal representative democratic republic, the authority is on the president and its multiple political parties. But what is happening right now?
Não vamos aceitar a política do fique em casa, feche tudo, lockdown. O vírus não vai embora. Esse vírus, como outros, vieram para ficar. E vão ficar a vida toda. É praticamente impossível erradicá-lo. E até lá, vamos fazer o quê?
The President Jair Bolsonaro does not implement stricter health and safety protocols. He even doubts mask efficacy and flouting public health recommendations. He even told one reporter,
Lamento. Todos nós vamos morrer um dia. Aqui todo mundo vai morrer. O Sérgio vai morrer um dia. Né, Sérgio? Não adianta fugir disso, fugir da realidade. Tem que deixar de ser um país de maricas.
people will have hope if this mindset of the president or the people in the government will change. There is a hope for the people in Brazil. Second, increase the percentage of immunization program. According to Luciano Guldani, the professor of medicine and editor-in-chief of Brazilian Journal for Infectious Diseases, that their immunization is very slow. With over 32 million of doses of vaccines, only 4% of people were fully vaccinated. If the government had prioritized vaccination in get-go, Brazil would have never experienced this kind of situation. Third, the government shall impose stricter health and safety protocols. According to experts, places that have been largely affected by the virus should put into lockdown and maintain social distancing, and also to avoid spread of the virus, and also to lessen the exhausted health facilities in Brazil.
This is a story about failed government leadership. Failed leadership because it neglected science, minimized the importance of the virus, and did not use the universal healthcare system and the primary healthcare network that Brazil has and is known to have it very good. Failed leadership because it disseminated wrong information, promoted the use of drugs with unproven effectiveness, among many other things. in the future, in the very near future, when we tell the story about this pandemic, there is a very important chapter about how bad leadership destroyed the opportunities that strong and resilient health systems had to respond to a pandemic.
What is happening in Brazil is a lesson to all nations. A leadership that does not prioritize its people is deadlier than any virus. As members of a global society, let us use our voices to inform people and take action in our role as citizens of the world.